Good morning. Today is a great day at PHRII. We are all heading off to the community for two camps, one for cervical cancer screening program and another one to screen antenatal care and HIV testing for pregnant women.
Perfect.
We're gonna enjoy the day, help lots of people, and post your comments and questions.
Hi everyone, welcome to Rammanahalli, which is one of the tribal villages here in India, where we're doing a lot of our research for the Global Health Study Abroad program. Today we're here in the town and we're running a clinic that's specifically doing cervical cancer screenings and particularly looking at HPV. And our students are involved taking blood pressure, taking height, helping with counseling, and actually helping with the exams as well. And we'll take you inside and show you exactly what we're doing. So this is the first stage of the busy, really crazy cancer screening projects going on. You're going to see all kinds of people walking back and forth. And what's happening here is that women are finding out about the project and what we're doing here. So what's really interesting is that this is sort of a first level of education of the project. But you really can't say the word sexual health here unless the women are married. So the wording is really important to really get the importance of understanding cultural competency when you're collecting research and doing research here in India. So they're being told about the study, and if they're interested, they'll go on and get some more training, which will take you to the other stations to find out more. So we're now at the second station, and this is where, after hearing the information like we did before about the study, this is where they then register. And they don't just register for the study, we gather information about who they are, but we also take their height, weight, and blood pressure to set a baseline for the study as we continue to the next stages. Thank you. How to tell you people. So now we have their height and weight, and we've just checked their blood pressure, and this is where the more in-depth information is collected. So here you can see that the women are now filling out a patient history form, which they do orally, and prior to that they sign the consent, and we get some demographic information about them as well. So now what's happening is that Dr. Vijaya is going to explain to the patients and also the grad student Holly how women can now collect their own vaginal swabs so that they can get these specimens for checking for cervical cancer cells. And this is the area where the women are taught how to do that. So what you're seeing right now is the actual exam room where they would do the pelvic exams. And from here, Dr. Vijaya, who is a gynecologist, would actually do the exams on these tables. And I think it's important to know that this entire exam room was brought here from PHRII. These are portable tables. These are strings hanging for the privacy curtain. This whole system is brought here from Mysore and set up in a classroom to help these women figure out what their health issues are. Thank you so much for joining us today as we gave you a trip through this rural cervical cancer check clinic. I want to stress that this is just one of the many clinics that PHRII, the Public Health Research Institute of India, does throughout the region. And everything you saw here is offered free of charge. These women don't pay for any of these services. So they really depend on us coming out and doing this type of work. And you can help by making donations to the Public Health Research Institute. If you want to do that, you can just go to their website at phrii.org, find out more about the services, and find out how you can get involved or how you can make a donation. So we can keep offering these women in these rural areas this type of help.
ਤੂੰ ਚੰਡੀਗੜ੍ਹ ਤੋਂ ਆਈ ਨੀ ਕਾਲਾ ਚਸ਼ਮਾ ਜੱਜਦਾ